Hey, my name is Leah Cowart, and I'm doing this presentation for my pathophysiology class. And this is my new card. So today I'm going to be talking about diseases. A disease is an acute or chronic illness that a person acquires or is born with that causes damage to one or more of the body's systems or organs. A disease can be classified as acute, which it comes on quickly and usually goes away just as quickly, or it can be chronic and the patient kind of progresses with this disease slowly over time and then they have to deal with it the rest of their life. So the disease I chose to talk about today is going to be a heart attack or myocardial infarction. As a cardiac intensive care unit nurse, I see this pretty much every shift that I work. I usually think most heart attacks are more of an acute issue. The patient has chest pain, they come right to the hospital, we stent them, and then they're back home. Or I could see also the chronic aspect of a heart attack where the patient's had chest pain for months and months. They don't come in until it gets really bad, and then at that point it's kind of too late to get a stent, and they find multiple blockages, and then they end up having to get open heart surgery, also known as a coronary artery bypass graft. So we see both aspects of that on my unit that I work on. Etiology is going to be known as the cause of the disease. So there can be multiple different etiologic factors that cause diseases. It can be biologic agents such as bacteria, viruses, physical forces such as burns, traumas. You can have chemical agents like poisons, alcohol, drugs. One of the more common I feel like is going to be genetic inheritance or nutritional excess and deficits. So with a heart attack, it's usually going to be that genetic component, looking at the patient's family history. Do they have many people with heart attacks? Do they have high cholesterol in their family? And then also looking at that individual's like weight, eating habits, exercise habits, do they smoke? All those type of things make up the cause of the disease. Then you get into pathogenesis, which is different from etiology because it's not the cause, but it's the progress of the disease itself on the body throughout the initial time that those arteries start to get atherosclerotic and clogged to the time that they come in with the chest pain and have the heart attack. Then we get into our signs and symptoms. Symptoms are going to be your subjective data that the patient tells you, such as, like, for my example would be chest pain, maybe they're short of breath, maybe they're dizzy. That's things that they tell you, whereas signs are objective data that we can observe and measure. So like high blood pressure, high heart rate, low oxygen saturation because of that shortness of breath. If they have a fever that we can take their temperature and measure, those are all signs and symptoms, which combined make a syndrome. So your syndrome is your signs and symptoms combined that make up that disease itself. Then we go into diagnosis, which is going to be designated for that disease itself. So like looking at the whole picture, which is going to be your patient's history, your physical exam, the results of your diagnostic testing, and coming up with that diagnosis, which in my case would be telling the patient that they have had a heart attack. Then you get into complications, which are your adverse reactions from the disease itself, or even complications from the testing that you have to do to diagnose the patient with this disease. So for example, when patients come back after they've gotten their stents to our floor, some of the complications we see are going to be like bleeding at the arterial site, whether it's radial or femoral, or the artery that they get the stent through. Or even like reperfusion arrhythmias. We see those where the arteries opened up, you have that blood flow, and then on the monitor we'll see runs of VTAC or PSVT, and the cardiologists just call that reperfusion arrhythmias. And then we get into prognosis, which is kind of like the forecast of the disease. So it's letting that patient know what to expect in the next weeks and months to come. For a heart attack, it's usually they go home in 2 days or so and they can resume their normal life, but they do need to be willing to make those lifestyle adjustments, better eating, exercise, those type of things to prevent them from coming right back into the hospital with the same issue. And then our diagnostic tests are the things we use to confirm our diagnosis. So for my example, it's going to be your lab draws, seeing those troponin draws, chest x-ray to rule out any other issues causing the shortness of breath, and even the cath procedure itself, like that's a diagnostic test when they shoot those arteries and we see the blockage, confirming that they do have a myocardial infarction. Oh, and EKGs, showing the STEMI on the EKG. Those are all examples of diagnostic tests. And that is it. Thank you.